Hi, this is Dr. Wu. Welcome back. If you don't know me, I'm a doctor of physical therapist. I practice in New Mexico, Albuquerque. And today's topic is about the concept of movement, like, which part of the body you use and which muscle you're using when you get into the position or get out of the position. And I see a lot of trouble from people with either hip pain or back pain. And so today's topic is we use that as an example of showing you what you can do to avoid the potential pain and why, and understand the condition better. Then next time when you talk to your doctor, don't just take the pain pills. Don't just accept a lot of imaging exam, because that doesn't really help you to avoid the trouble. So, and here's why. Now, for example, I'm going to use this as example is bending forward. Okay, when you're bending forward to pick up things on the floor, and sometimes you need to bending over, and to when you pick it up things, and then you have two parts of the body that might move. One is the lumbar, another is hip. So which part of the body you want to move? You want to use more lumbar or spine, or you want to use more hip? All right, and so if you use more hip, what's going to happen to your lumbar? Okay, and I'm going to show you this picture of bending over. All right, now as you can see, if you're bending over like this in this picture, so basically you have the hip and you have the lumbar. So you need to have the lumbar and then hip move together, and so that is what it is most of the time. But if in this picture your hip is somehow stiff, arthritis, stiffness, just not enough workout, what's going to happen here is that the lumbar here need to compensate, do more, or the thoracic spine need to do more. So the spine itself might be taking more loading. What if this one here, if your lumbar is discomfort and you don't feel like you want to do too much from there, what's going to happen here is you need to use more from the hip. All right, and so that is bending over. All right, so, and that is what I'm talking about, the concept of when you're bending over, which part of the body you're actually using. So you're using bending over from the hip, then your lumbar might not have that flexibility, vice versa. Okay, so sometimes we want to encourage more hip flexible, or encourage more the lumbar movement over there. So it depends. Okay, but at least you know that when you're bending over, it's possible. And my point is that the movement itself, actually, we need to be more specific about which part of the body you're using. Okay, what about return from bending over posture? You want to return. Some of them might do a lot of the kettlebell exercise. When you go to the gym, the trainer will teach you bending over and then come back and swing your kettlebell forward. And what are you actually doing? What are you actually doing? So are you truly using your the right muscles to protect you, or are you actually causing a lot of trouble there? All right, and so this is the following picture is going to help you to understand that. Okay, now, and in these pictures you can see it tells you, in this position here, I'm going to use this one here. So basically, when you are bending forward pretty deep, and then when you're ready to stand up, the gluteus muscles here actually need to kick in. Then the lumbar extensors will also kick in, but they're very mild, because you can see the color is pink. This one is dark red, means that this one you have a lot. So hamstrings, gluteus muscles, and the back extensors. All right, so back extensor is not the main muscles, but if you use it, overuse it, that's wrong. Now, when you get to this one here, is kind of a little bit more. We get about like 45 degrees or even more, almost like a straight. Then is when the back extensors kicks in. That's when it's safe to do so, and you have you still need to use the gluteus muscles there. Then you can get completely straight. Okay, so then you can see here, from here to here to here, the gluteus muscle need to kick in, then your back extensor muscles will also follow, and then you can stand straight. Okay, now, that's my point over here. It's very interesting to see, because I have the my patients to do those activities, and I noticed that a lot of them, when they're bending over, they actually using a lot of lumbar without the hip because the hamstrings are so tight, or that's the habit there, or arthritis in the hip, and then they complain about back pain. And that's why you have that, you overuse it. All right, that's as simple as that. Now, when you return, a lot of them, they use the back extensors, and then they feel like soreness. They feel like a very limited endurance, means that you do certain things and you get tired very quickly. And that's why. And that's exactly, what we want to do is to avoid that from happening. Yeah, if you do have the back pain, you have the hip pain, or you have other things in discomfort in your legs, ask yourself, are you using the right muscles at the right time? Are you paying attention to what group of tissues need to take the loading? All right. So another example is that if you're driving your car, most of us drive cars. So if your car, the alignment is not right, and then you try to keep pushing it, keep walking it, it's going to stay? No, it's not going to stay. You got to go to the mechanics, get the alignment checked. The same thing here. Our body, because we have our habit when we get, getting used to things, and then habit develop, that's very common. And so next time when you bending over, pick things up, think more about your gluteus muscles there, all right? And if you're not sure and you have hip pain or back pain and you want to have someone to talk to, you can contact me. I give you 20 minutes free of the free of charge time. Then you can talk to me, understand those conditions. If you want to come in, again, 20 minutes, we'll give you a free assessment there, and to let you understand that what is going on and what can be done for you. Okay? All right. Thank you very much. And this is Dr. Wu. Until next time. Thank you. Bye.